Good afternoon. This is Bill Hughes with Benefix. I'm here today to review your 2022-2023 Smith Pump Company Employee Benefit Guide. Whether you're a current employee or a new hire looking at your benefits, thank you for coming on and we'll dive in. One of the most important things I want you to understand are ways to maximize your benefits. This plan has tremendous benefits. Smith Pump Company pays 100% of your medical plan, as well as life, short-term, and long-term disability. But let's look at 5 tips to totally maximize your benefits. The first one is, that you'll see on the page here, schedule surgeries and hospital stays with direct contracted hospitals. We have the medical hospital system in Dallas and Houston, and the University Medical System in San Antonio, where you can get 100% coverage, no deductibles, no out-of-pocket. Number 2, call the medical helpline to get pre-authorizations and for help on surgeons, identifying surgeons. They can help you locate surgeons that are qualified or recognized to operate in these hospitals that we've just talked about. Number 3, contact Sharks to get high-cost drugs, either free or deeply discounted. A high-cost drug is one that costs $350 a month or more, but we have drugs, high-cost drugs that cost $50,000 and $60,000 per year, some even more than that. Last year, Sharks saved Smith Pump Company employees in their plan over $166,000. This is very valuable to you. If Sharks calls you, sometimes they're going to reach out to you. When they see a fill, you'll need to call them. If you don't respond to them, that will result in your high-cost meds not being covered. Number 4, call Green Imaging to schedule imaging, CAT scans, PET scans, MRIs, ultrasounds or x-rays, and get 100% coverage. Number 5, schedule lab work with LabCorp or Quest to get 100% paid. Now, what often happens is you go to a provider and they send you to the lab down the hall or send you to a place to get the lab or the imaging done. Stop and think before you allow them to do that. Call Green Imaging. Go to Quest. Go to LabCorp. Get these done for free. All right, your plan changes for 2022 and 23. First of all, as we talk about emergency room, emergency room should only be used for life-threatening events. The copay for emergency room visits will change this year to $500 up from $200, which is waived if you're admitted. But if you think you're having a heart attack, that's a life-threatening event. You should go to the emergency room. But if I've broken my thumb, that's probably not going to be life-threatening. That's something that I can go to an urgent care facility for. By using your physician, convenience care, urgent care, you're going to save anywhere from $465 to $490. But if you use Teladoc, which is telephonic medicine, you'll save the full $500. So just a reminder, if it has ER in the name, that's an emergency room. So advantages of your Smith Pump Company benefit plan. First of all, 100% of the premium is paid by Smith Pump for the employee. Many employers only pay 50%. Number 2, your family monthly maximum deductible is $2,000. Now, all deductibles and co-payments in a year will max out at $5,000 per individual. Many other employer plans cost up to $8,000 or more out of pocket. And if you look at the tools and the services that we talked about just a moment ago, sometimes you can make your out-of-pocket zero for certain things. Smith Pump Company also pays for your life, short-term disability, and long-term disability to age 65. So how much is that package worth to me as an employee? Well, by the time you factor in the tax savings on these benefits, about $8,350. That's up to about $4 an hour. You have low deductibles and out-of-pockets that can be worth $5,000 to $10,000 if you or your family use the tools in a plan for hospital surgery and high-cost drugs and lab work. Those are real benefits. Here you'll see numbers for the different vendors within the plan. Entrust is the claims payer. You see the PPO network, HealthSmart. Then if you're going out of state, we use First Health, similar name but a different network. And then you'll see the numbers to call for pre-authorization, utilization review for surgery, or your Ask a Nurse line. And then numbers to contact Green Imaging. Southern Scripts is your pharmacy benefit manager. And Sharks is the one that handles the specialty high-cost drugs. So a little bit about how your plan works. You have your HealthSmart Preferred PPO Plan A. The plan's contracted with HealthSmart, and you can find network providers in network through the website here or by phone. Also, if you're going out of network, First Health, here's your contact information for them as well. Direct contracted facilities. Those are facilities where you can get 100% paid, no deductible, no out of pocket. You've got the Methodist Hospital System in Houston and Dallas. You've got the University Health System in San Antonio. So if you're going to have surgery and it's planned, you can go there. Now, we've not told you that you have to go there, but this would be a superior option as far as your out-of-pocket goes. So make sure if you use these that you're using a physician in the HealthSmart Preferred PPO network who has admitting privileges at one of those direct contracted facilities. And then your deductible will not apply to the physician charges as well. That's a great benefit, and I encourage you to take advantage of it. Prior authorization review is required for inpatient hospital admission, surgeries, and so forth. So be sure that you call these numbers in the plan here for that. Eligibility. Full-time employees that work at least 30 hours per week are eligible on the first day of the month following their employment, and eligible dependents would be a legal spouse, children of an eligible employee up to age 26, any child under legal guardianship up to 26, stepchildren up to 26, dependent children required to be covered through a qualified medical support order are eligible. Any child meeting the criteria above who is over 26 and legally incapacitated, and all employees must either accept or waive coverage. If you go down to the bottom, you'll see your employee weekly contribution amounts. Smith Pump Company pays for the employee, so you have no cost. But for spouse, the weekly cost is $121.44. For children, $82.30. For an employee and family, $199.71. Here you'll see your summary of benefits, which shows your family monthly deductible at $2,000. Your out-of-pockets at $5,000. Your coinsurance at 100%, by the way, after the deductible. So your deductibles, all these co-payments you'll see on these $20 amounts, $35 amounts, all of those add up one time maximum of $5,000. And then a family amount at $10,000. You'll see the deductibles and so forth, co-pays on physicians, specialists, preventive care, urgent care, outpatient diagnostic lab and radiation. That's covered at 100%. Prescription drugs. Your prescription drugs, you'll have co-payments on your card for prescription drugs. Remember the Sharks plan for your high-cost drugs. And here you'll see your direct contracted facilities. You'll see them in both Houston, San Antonio, and the Dallas area. Teladoc. Here's a number to reach Teladoc. You can go to teladoc.com and set up your account. And in setting this up, this is how you get $0 copay payment for telephonic medicine. So I encourage you to download that Teladoc app and make use of that when it's appropriate. It's available. Teladoc's available 24 hours a day, 7 days a week, nights, weekends, holidays. You'll see here some contact information for your networks, for Green Imaging, and for that medical helpline. Here are your COBRA rates if you're terminating from your plan. These are your COBRA rates. And this is what it costs you monthly on COBRA. Your medical helpline, here are items that are required for you to call the medical helpline. And so you'll see all inpatient admissions, durable medical equipment, diagnostic tests, outpatient psychiatric, outpatient procedures and surgery, outpatient continuing care services, and medications, injections, and infusions that are greater than $2,000. Your benefit card, your benefit administrator information, your group number, submission information, PPO network information, pharmacy information, pre-authorization and review contact information, that's all on your card. And then here's a sample of what your card will look like if you don't already have one. There's a member portal at 90 Degree Benefits, so you can go on to 90degreebenefits.com and follow the directions and you can set up a member portal. Entrust is a 90 Degree Benefit company. They're owned by 90 Degree Benefits, which is owned by Blue Cross and Blue Shield of Alabama. Southern Scripts is your pharmacy benefit manager. So Southern Scripts fills the everyday drug. So you can look for information here, and first choice retail pharmacies are the preferred source, but you can get drugs in many other places and they're covered by Southern Scripts. But we get the biggest discounts at first choice retail pharmacies. And then the Sharks plan comes into play when we have high cost drugs. Here you can find mail order pharmacies where you can get mail order for your drugs that continue on, month after month, maintenance meds. And so you can get instant access to your benefits, price check tools, and more by registering on your member page. And please note that registration is only available after your plan effective date at Southern Scripts. Labs, diagnostic, and imaging. These are some things that are typical lab tests for LabCorp and Quest. And then for Green Imaging, you can see some of the types of scans that Green Imaging provides at a zero cost. Tremendous benefit. Just last week, my wife and I got some MRIs done for her, and our costs were discounted about 75% with Green Imaging. Here's your Informed app with Entrust. You can get on your Informed app. You can check claims, you can check your plan document, all things medical plan. With Entrust, you can get on here and have your personalized dashboard. This is a map of covered radiology services for Green Imaging. Information about your Sharks program. And if